Okay, which shoulder are we looking at?
Right,
The
and
right.
I'm right-handed.
Okay. Well, look, we're going to talk about your right shoulder first. I'm going to ask you some specific questions about the shoulder, and then afterwards we're going to talk about the history. Now, we're doing it back to front because this gives me an opportunity to see where you are now, and then we can sort of talk about what you've done in the past. Okay. So, pain, aching, stiffness, all of the above?
Yes, it was. It varied during this year.
Okay, so pain, aching, and stiffness. Do you have a sharp catching pain if you reach for things in the wrong way?
I do.
You get that severe sharp catching pain?
Well, I've learned not to
But you still get that
reach
sometimes?
anymore. Yeah.
Do you get a pain down the outside of the top of the arm at all?
It's more here in the front.
In the front, okay. Do you have any night pain?
Between January and July, I couldn't sleep at all.
Right.
And now it got slightly better.
Can you lie on that side at all?
I couldn't, but now I can.
How long can you lie there for? 5 minutes, 10 minutes?
No, maybe half an hour.
So less than half an hour. Half an hour.
I mean, if I'm sleeping, I don't know how long I'm lying on it.
If you lie on that side, do you find you wake up very stiff? You have to turn off of it at some point.
I do think I turn off.
Are you still waking up at night a little bit?
No.
Do you have decreased range of motion with that arm?
Oh, yes.
Severely, okay.
It got slightly better now, but at one point I really couldn't move it at all.
So the sort of things you're finding difficult, is it sort of reaching behind you?
Washing hair,
Yeah.
Doing the bra is impossible.
Yeah, doing the bra.
Carrying things.
Reaching for a shelf or something like that?
I can't do that at all. Ringing bells. For example, if I'm carrying a backpack, it does hurt.
Okay, thanks. Okay, now we're going to talk about your history of when it started and a little bit about what you've had done in the past. So, when did this start?
I think it started hurting October last year.
So October 03. And did it start with any particular reason? Can you remember anything?
No, I just noticed it was hurting a bit more and hurting a bit more.
So no apparent reason, but you know it started with an ache?
Yeah, I just noticed it was a bit stiff. I noticed, for example, if I would move my arm, it would make some strange noises.
Right.
Okay. And it was just hurting a little bit and hurting more, and I just noticed it was actually hurting
it got
consistently.
More worse. So it kind of crescendoed. And when did it get to its worst?
Well, then I kept working. I thought I would stop over Christmas anyway, so that would get better. But then when I came back to work, beginning of January, I noticed it was still hurting. It was hurting more.
Right.
Then I stopped working and saw an osteopath.
So did you go, I was going to say, did you see a doctor? What did you do?
No, I went straight to an osteopath.
You went to an osteopath?
Yeah.
And how many times did you go there?
3 or 4.
And what did the osteopath say?
We were not sure if it was a frozen shoulder or tendonitis.
Right.
So he did tell me to use some cold bags if it was too inflamed.
Yeah.
And also to rest the arm a lot.
Oh, he told you to rest the arm?
Yeah.
Did you rest it?
I did. For some time I was then walking around with
just
a sling.
In a sling?
Yeah.
Okay. Do you think that made it worse?
I think from then on I couldn't move.
No. All right. So once you'd done that, the movement was lost.
Yeah.
So what happened next? Did you?
Well, then I stopped working.
Yeah.
Because I was still trying to work with computers or something else I could do.
Yeah.
But then after the sling, and I couldn't move anymore. So that was 3rd week of January.
Right. So 3rd week Jan.
And it was exactly in 1 week I couldn't move my arm anymore.
So within 1 week it already seized up.
Yeah. And then I just took my time and waited and thought maybe one day it'll get better.
Did you go to the doctor at all?
Well, then in March I went to the doctor.
Right. And what did the doctor say?
He wanted to give me injections, and I said definitely no.
Did he say it was a frozen shoulder? Did he diagnose?
Yes.
Good. And he offered you a steroid injection.
Yes.
And you didn't do that?
And I said no, and he said I would be begging for it in the future. But I said no.
Have you seen anyone else or had any other treatment?
I had acupuncture. Because then when I saw my GP, I got into the NHS waiting list for the physiotherapy.
Oh, right, yeah.
So that was about 6 months. So I saw an acupuncturist.
How many times did you try that?
That was every 2nd week.
Yes.
that went from April to July.
So April, May, June, July. So you really went sort of about what, 16 to 20 times?
Yeah, well,
like
let's say about 12. Maybe I missed
12,
one or two.
12
yeah.
times. And do you think that helped it a little
It
bit?
helped with the pain.
So it helped to reduce
Yeah,
the pain?
it didn't increase the movement,
range, yeah.
but it really helped with pain.
So that takes us up to what, about June, July, did you say?
So June, July, the pain ceased a bit. July.
Yeah.
June was still very bad.
Right, it's a bit less pain
In
then.
July, the pain kind of, I started
yeah.
sleeping again.
Good, good.
And then I started the physiotherapy with the NHS.
Yeah. How many sessions?
And that was in mid-September.
So you started in mid-September?
Yes.
Right.
So at the beginning it was fine. I was seeing a physiotherapist that was very gentle with my shoulder. And then I started doing also hydrotherapy in the swimming pool.
Yeah.
And that hurt a lot because I was using floaters or things that would just force my arm out. And that hurt so much.
Right. Yeah. And how many sessions of hydrotherapy did you have?
About 4.
About 4 sessions.
Oh, and then I saw a kinesiologist.
Uh-huh.
And when I did the kinesiology, actually I'm a bit confused here. The kinesiology was in August.
In August.
Before the physiotherapy.
Right.
And the kinesiology helped me to be able to ride my bike again.
So it helps get some
just a
range.
little bit of movement, not much sideways, but at least to the front was just enough for me then to ride the bike.
Fine. Okay.
And then I started the physiotherapy.
Okay, good. Fine. That's all I need for there. Is there any previous history I should be aware about? Anything like a neck problems? Or
When
back
I was
problems?
about 7, I broke one of my
collarbones.
I
Which
can't
ones?
remember which
No.
one. I
Is it a
think
bit
could
lumpy?
have been the left one actually.
Okay, well we can sort of check that out. But that's the clavicle. That's the only thing.
A bit of lower back pain.
Okay.
That the same osteopath treated it very well before,
Good.
like 2 years ago.
Okay, good. Any accidents in the past? Broken bones, whiplash, car accidents, other than this fracture we're talking about here?
Maybe whiplash, but not that strong, and that was in the 1998.
A mild road traffic accident, 1998. Any illnesses or medical conditions that you suffer with?
Such as, because I don't know
Diabetes
if any diabetes,
or heart
definitely
problems?
not.
No.
Just checked it because I know you get more
Good.
frozen
Okay.
shoulder if you're diabetic,
Yeah.
but definitely not.
Okay. Any operations that you've had at all that I should be aware of? Anything relevant?
No.
Okay. Is there any diabetes in your family or any history?
Yes, paternal uncle.
A paternal uncle. Was that an adult onset?
Yes.
Okay. Fine. Nearly there. Just to talk about your general health now. You said you're right-handed.
Yep.
Are you right or left-footed?
I've never played
If you
football.
were to
I don't know.
Kick an osteopath, for example.
Right.
Okay. Okay. Just a few yeses and nos. Do you suffer with your tummy at all? Constipation or diarrhea?
I did in the past, but since I became vegetarian, got much better.
Nausea or vomiting?
No. Sometimes a bit of nausea when it's really hot,
Right.
and I think what I suffer of is a bit of low blood pressure.
Do you find you get dizzy when you stand up quickly or after a hot bath?
Yes.
Okay. Well, we can check your blood pressure as well.
And usually it's on the low.
Low side.
Yeah.
Do you get indigestion or acidity or reflux?
Not often.
Fine. And waterworks. Have you noticed you've been passing water more frequently, urinating more frequently?
No, but I've been trying to drink more water.
Okay.
And that, obviously there is a bit more.
But you don't get any excessive thirst, you don't get thirsty at all?
No.
And when were you checked for diabetes and who checked that? Was it the doctor?
I was first at the practice, and then I did a blood test in the hospital.
Right. And it was nothing?
No.
Gynecologically, do you have a regular cycle?
Very short.
Short cycle?
About 3 weeks.
And has that changed recently, or
No.
it's still the same?
I did miss 1 or 2 periods in April,
Right.
But well, I don't know when.
Yeah. Your heart and lungs, as far as you know, they're good, apart from
Yep.
the low blood pressure. Do
Yep.
you suffer with chest pain?
No.
Palpitations?
No.
Cold hands and feet?
No.
So you've got good circulation.
Although I do feel cold here.
You feel the cold here, of course. We all
But
feel
not
it.
particularly in hands or
Okay.
feet.
Do you suffer with shortness of breath?
If I'm unfit, yes.
But
only if I'm exercising.
yeah, you don't sort of wake up feeling
No.
like you can't
No.
breathe. Do you suffer with headaches or dizzy spells?
No.
Do you know if you get any pins and needles into your hand or numbness or anything into that right hand at all?
No, I did in January, February. Then part of the pain was
Into the hand and wrist?
yes,
Yeah.
yes.
The whole hand
But
or
usually it's
specific
fine.
fingers or?
I'm not sure I remember it, but I do
But
tend to
an
think
aching
more
into
the thumb and these two fingers a
Right.
bit more.
Do you suffer with allergies at all?
Not that I
No,
know.
none that you know about. Are you allergic to Nivea cream or lanolin at
No.
all? Do you eat well? You said you're vegetarian. How long have you been a vegetarian for?
6 years.
And do you really watch the protein and the,
Maybe I like a bit of protein.
smoker?
No.
Alcohol?
No.
Any medication you take regularly for anything? Sort of vitamins, minerals or medicines?
Oh no, just have the spells of, I don't know, wheatgrass juice or things,
So,
but
yeah.
they come and go.
Okay, fine. Good. Well, let's have a little look if that's okay. And I'll leave you to get changed, and I'll be with you shortly.
Okay.
Okay, thanks. What we're going